Okay, good morning, doctors. Dr. Cronk here with Spinal Kinetics. I'm very, very happy to have a kind of a different program today than what we normally present. And I'm very proud and very happy to have an Amazon best-selling author, Dr. Moira Dolan. And she's going to be explaining how drugs may complicate spinal ligament injuries. Now, you may wonder, well, how do we get here? How did I get there? As most of you know, Spinal Kinetics is a well-known company for raising the issue and raising the bar on spinal instability. And spinal instability is very, very easy to determine in the spine. That's what we do as a company. We do it in the cervical spine, we do it in the lumbar spine, and we're probably one of the most prominent companies in the country that addresses this and brings attention to all doctors, medical doctors, chiropractic doctors, osteopathic doctors, on the significance of these conditions. And why? Because these conditions can cause, spinal ligament injuries can cause neck pain, migraine headaches, lower back pain, pain radiating down the arms, down the legs, shoulder pain, scapular pain, ear pain, face pain, numbness and tingling or sense of weakness in the arms, same in the legs. I mean, these are common. What I have up on the screen right now are very common spinal ligament injuries, spinal ligament symptoms. Concussive syndrome, you go to the craniocervical junction for the ligament injuries. Disturbances in concentration, disturbances in memory, difficulty breathing, difficulty swallowing, loss of the voice, visual disturbances, ringing in the ears, sinus congestion, bladder and bowel dysfunction. These are common symptoms that are associated with spinal ligament injuries, and we know that the ability of the doctor is to diagnose, well, what is causing these things, right? Now, the very, very simple thing that I would say from 17 years of being in private practice and knowing private practice extremely well is that patients come in and they're complicated. They're all different. But one of the things that makes them the same, especially in a chiropractic practice, is many of the patients are coming in and they've been under medical care all their life, and a lot of them are on one drug, two drug, combinations of drugs. And so always as a doctor of chiropractic, for me, one of the considerations I had was could this symptom, could these headaches possibly be from the medications they're taking? Could the pain be possibly from the medications that they're taking? And it was always a challenge to try to figure out, well, how do I address that with a patient? As a doctor of chiropractic, I can't really address that, and we address it naturally. And so I thought it was a beautiful segue in, one, because some of these drugs can cause problems with ligament injuries, but also they're common issues that you deal with every single day of your practice life. So it was a really easy segue to say, I took a look and read the books, the No-Nonsense Guide to Cholesterol Medications, No-Nonsense Guide to Antibiotics, No-Nonsense Guide to Psychiatric Drugs. I thought they were the best, most simple, most direct books I'd ever read on the subjects. And they were easy enough that it was easy for me to look at and say, there's not a patient in the world that is going to contemplate or is on these drugs or has kids that they're contemplating putting on these drugs that shouldn't get a copy of this and made available the information that Dr. Moira Dolan has produced in these books. So with no further ado, I'm going to introduce Dr. Dolan. She's earned her medical degree at the University of Illinois Medical School. She's a board-certified internal medicine specialist. She's additionally certified by the American Academy for Anti-Aging and Regenerative Medicine. She's practiced in a variety of settings for over 3 decades. She's testified before the FDA on various legislative bodies on matters of drug hazards and patient rights. So she not only talks the talk, she walks the walk. She's an ardent patient advocate with a primary focus on informed consent. In other words, the patient's right to know, the patient's right to be fully informed before they make a decision on what they're going to do. Dr. Dolan is a best-selling author, as I originated earlier, on Amazon with her series of no-nonsense guides. And she writes a blog that you're all going to want to check out called smartmedinfo.com. It has a tagline, and the tagline couldn't be more perfect. It's medical news you can use. So with no further ado, Dr. Dolan, can you hear me?
Yes, thank you, Dr. Cronk. It's a pleasure to be here.
Perfect. So I'm so happy to have you on this morning, and I know that the doctors that are listening have a rare opportunity to get some information, and I don't think that they, a lot of times I know it's a problem, but they don't necessarily know where to get good information. So I guess the first question I have for you this morning is, how did you as a medical doctor practicing within, kind of a patient-unfriendly medical system as we know it, come to work in the field of patient advocacy?
Well, first of all, even when I went to medical school way back in 1980, I came into it already having experience with some alternative practices like acupuncture and chiropractic, and I was well aware that in the medical system we're just on a drug and surgery model and don't have all the answers. Then I had experiences not just with my patients had been subject to drug adverse effects, but myself as a patient experiencing drug adverse effects. And I really adopted the policy of treating patients like I would treat myself or my family instead of having this artificial separation there. This goes way back to surveys that were done a couple decades ago, reported in the New England Journal of Medicine, where they asked doctors, would you take XYZ medication or submit to XYZ surgery? And most of the doctors said, heck no, and yet they're prescribing this day and night for their patients. So it's really unethical in that regard. So I really just took the viewpoint of the patient and really looked at my Hippocratic Oath, which really doesn't say first do no harm. That's how it's been popularly transcribed, but it basically says I will not prescribe dangerous drugs. Now obviously sometimes we have to prescribe a dangerous drug to save a life, but instead what's happened in the United States in particular is prescribing a pill for everything that ails you, with no regard in most cases for informing the patient at all about the potential adverse effects.
Beautiful, beautiful. So, doctors, as a doctor that's read Dr. Dolan's books, one of the things that I like the most, it's very easy to write. It's kind of easy to read books that are sort of anti-something, and what becomes really apparent when you read these books, and I'm going to highly recommend that all of you download and get a copy. These books are like less than $4 on Amazon. What becomes readily apparent is this is not an anti-drug book. These are not anti-drug books. These are pro-informed consent. And I guess I'd have to have you speak to that just a little bit, in the fact that, like I said, for me, reading these books, what became so apparent and so refreshing was because sometimes chiropractors are looked upon as anti-drug, right? And sort of like, well, you're always going to be going against the drugs. I looked at these as a perfect segue because they're written, one, by a medical doctor, and they're not written to attack the drugs themselves. They're written to provide informed consent.
Exactly. And, part of the reason that I wrote these is because I was spending long time periods with patients educating them on what's known and not known, for instance, about cholesterol medications, regarding their effectiveness and their safety, what's known and not known about the upsides and downsides of antibiotics or psychiatric drugs. And really spent so much time trying to educate my patients. And a lot of times it was an uphill battle because they had heard other things from the popular media or their doctors who are rather glibly just giving this stuff out without themselves knowing really anything about the studies behind them regarding safety and effectiveness or lack thereof. And then I developed a blog to try to educate patients and to put this stuff in a more systematized fashion so I could refer them to it. And then I started to get requests for it, and I realized that we have a real deficit of informed consent. Now, for instance, on cholesterol medications, if somebody says, should I be on a statin drug? Well, there's no yes or no answer. In my experience, out of 100 people that come to me already on statin drugs, about 2 of them actually need to be on the statin drug. So for that 2%, the answer is yes. you should be on the statin drug, but that means for 98% they have no business being on it, and they're only engendering the severe adverse effects of statin drugs, which can include, myopathy, tendinopathy, ligament injuries, memory loss. I mean, the list goes on and on.
Perfect. So, again, doctors, the thing that I was so impressed with in these books is that they're so informed consent. When a person is fully apprised of the data, the knowledge, they can make better decisions. If they fully understand what chiropractic and what alternative type treatments like chiropractic can provide, it's been my experience that they'll choose it. It's also been my experience that if they fully understand the different types of procedures that they're about to embark upon, say a spinal surgery, and the results of those spinal surgeries, which oftentimes aren't presented, with the sort of okay, this is what the normal, results are, patients can make better decisions. So what impressed me so much about Dr. Dolan was that was what she was all about. She was about giving the patients the true information, great information, not information that's opinion-based, information that anybody can look up on the internet today and get consensus with. So, the next thing I'd say is, as chiropractors, Dr. Dolan, obviously, chiropractors don't prescribe drugs. So what do you see the role in helping patients what do you see their role in helping patients who are on these medications?
Well, there's a lot of patients who consider their chiropractor their primary care doctor, and they come to you with questions about their medications and vaccinations and antibiotics and all kinds of things. And I think that chiropractors should never underestimate their role as opinion leaders for their patients. And maybe you do or don't see yourself as an opinion leader. If you don't, it may be because you're not putting yourself out there and giving opinions. And I think that you're well qualified to have opinions and to give opinions. Now, I went to my chiropractor this morning, and he said, when I see people come in here on statin drugs, I start off saying, why are you on it? And then I find out most patients don't even know why. Well, my cholesterol was 200. Hello, that's normal. They don't really even know why they're on it. But then he says, look, I can't tell you to come off of it. But what he could do is refer them to a resource that provides that information. I didn't even have time in my busy practice to go through everything people needed to know about cholesterol medications. I had to put it in writing for them, and all these books are written in lay language. They're great reference books that you could just pick up and refer to. Like in the cholesterol book, for instance, there's a section on the effect on the nervous system and memory problems. There's a section on what it does to your blood sugar. There's a section on, what it does to your digestion and to your musculoskeletal system. So they're great reference books. But again, the role of chiropractors is to act as opinion leaders who, especially when you're the primary care practitioner, and I just really wouldn't underestimate the influence of your opinion, particularly if you can refer to authoritative sources, because the kind of information that's in these no-nonsense guides, as Dr. Cronk, you said, is really revolves around informed consent. I'm not saying these drugs are bad or those drugs are bad, but when you finish reading these books, you may well conclude, this is ridiculous, I'm not taking this medication. And you're going to find out a lot of information that is completely available to any medical doctor, but that they neglect to inform their patients. So I've mentioned informed consent several times so far this morning, but let me describe exactly what that is. And in fact, when I do continuing education seminars for MDs, and I say, what is informed consent? I've had rooms of hundreds of people where not one person can raise their hand and give me a definition of informed consent, and yet it's required, and it's the basis of virtually all malpractice cases, that there was a lack of informed consent. So it's simply letting the person know what the proposed treatment or test for that matter is, and letting them know how it works, what it is, what's known and not known about the safety, and sometimes the not known is even more important. For instance, Ritalin was never studied more than 4 months. Kids are usually on it a minimum of 9 months a year, but it was never studied consecutively for more than 4 months. I mean, that's a not known. We don't know the safety, beyond 4 months. We know a lot of the dangers within 4 months, but we don't know the safety and dangers beyond that in a systematic study. And so what's known and not known about the safety, but also what's known and not known about the effectiveness. Like, it's been well documented in multiple studies that most antidepressants are no more effective than regular exercise for treating mild to moderate depression. And yet that's the biggest category of people who are taking antidepressant medications that have a black box warning for promoting suicide, even in people who weren't suicidal before they got on the drugs. So what's known and not known about the safety, what's known and not known about effectiveness, and part of informed consent is what are the viable alternatives. And there's, as you guys know, lots of viable alternatives. And that's part of informed consent that says, look, if you don't take this medication, chances are your cholesterol is not going to kill you anyway. So a viable alternative would be diet and exercise, for instance. So what's in the no-nonsense guides is really an orientation to informed consent, but then there's specifics depending on the medication category we're talking about.
Okay, so just from being in private practice for 17 years, I'm gonna bring one up, just kind of off the cuff. Is a lot of times doctors of chiropractic will struggle with the fact that they have parents that have young kids who have ear infections, and they've had chronic ear infections. They're on chronic antibiotics, and they're looking at tubes, and then they come into a chiropractic office. And so, the kind of things that you have in these books on antibiotics, would it explain some of the things that most of these conditions are viral and not bacterial in nature?
Yeah, absolutely. And in the book on No Nonsense Guide to Antibiotics, there are benefits and proper uses of antibiotics, but the majority of what's going on out there is handing out antibiotics completely unnecessarily. And a huge category is this business of ear infections in children. Most of that, as a lot of you guys probably already know, is related to food sensitivities, particularly dairy. And if you can take the kids off of dairy, you'll see this incidence of ear infections either go way down or be eliminated altogether. Of course, there's other things that can cause allergies, and there's orthopedic conditions. I mean, there's chiropractic conditions. So, again, this is all part of informed consent. If somebody's coming in with recurrent ear infections, or another one is, treating every little sore throat with an antibiotic, every little runny nose with an antibiotic, when there could be musculoskeletal conditions that it could respond to, or dietary changes or environmental changes.
Doctors, this is a great lead-in too. This is how I got to having Dr. Dolan on with the program today. Was she was talking about some drugs that she was talking about a drug in particular, Cipro, that had some really detrimental, or can have some fairly detrimental effects to the ligaments and tendons of the body. And that's what got me thinking, okay, great, I need to bring on expert in this area, one who can assist you in your common and everyday practice of getting out better information to patients, but two, just to kind of give you an idea of things to think with when you are trying to get ligament injuries in a patient to heal and take out the chronicity of the situation. One of the things that you can think with, if that situation is not abating, is other things that might be causing it to slow in its healing. And that's where, Dr. Dolan, that was one of the most fascinating things. So what can you tell us about the medications that affect the kinds of musculoskeletal issues we deal with in a chiropractic office?
Well, there's really 4 main classes of drugs that have been well documented to be associated with musculoskeletal problems. You mentioned, Cipro, that is a quinolone antibiotic. We know them more commonly as the floxin drugs. They cause all kinds of adverse effects, and I'm really dismayed that they're actually still on the market. They're getting increasingly, antibiotics are getting increasingly ineffective because they're so overused that there's a huge amount of antibiotic resistance. So they're nowhere near the wonder drugs that they were when they first came out. That's particularly true of the floxin antibiotics. But within 1 day of taking a drug from that class of antibiotic, a person can experience a ligament injury. They can get an Achilles tendon tear. They can get myopathy within just 1 day of taking it. But also, these drugs are often given for urinary tract problems. And a urinary tract course of treatment for a urinary tract infection typically is only 3 to 5 days. So with such a short course of antibiotics, we find that even up to 12 months later, a person is still prone to get a tendon or ligament injury after being on afloxacin antibiotics. And it can even happen after just taking these medications as ear drops or eye drops, for instance. There's definite reports in the medical literature with such minimal exposure where only 2% of the drug is really absorbed systemically. They also deplete all the B vitamins and zinc, which, as you know, are very important for ligament and tendon and muscle. So quinolone antibiotics are one big category. Another big category, as we mentioned, is the statins. They're best known for myopathy. Of course, they deplete CoQ10. They severely reduce exercise endurance. And what happens if somebody's exercising while they're on statins, the muscles and the mitochondria in the muscles are impaired by the drug. And as a result, the mechanical forces are going to be more transferred to the tendons and ligaments and promote injuries there. They actually prevent the benefits of exercise because under the influence of statins, the muscle fibers don't respond normally. They actually blunt the exercise-induced muscle fiber lengthening, and they significantly reduce mitochondrial content, as I mentioned. They can also directly cause a tendinopathy, particularly if the person is in an acidic state. If their blood is somewhat acidic, as a lot of our ill patients are, they become directly toxic to tendons. So the acid-base balance of the patient can have a lot to do if they're at a higher risk for that drug effect. They also increase musculoskeletal sensitivity to damage from various substances like caffeine or anesthetics. So if somebody's on a statin and they're exposed to excess caffeine or excess halothane anesthesia, they're going to be more likely to have a tendon, ligament, or muscle injury than the next person. So between the effect on muscles, tendons, and ligaments, statins are one of the biggest ones, especially since it's now estimated that something like 41% of adult Americans are on these drugs. Now, another class, a little bit less known, is the aromatase inhibitors. These are typically given to people who have had treatment for breast cancer, and they definitely can cause tendon and ligament injuries. And then steroids. Of course, orthopedists have been just blindly injecting steroids into backs and joints for decades, and it's extremely well documented. This is disastrous to the tendons and ligaments, and it's very suppressive to the stem cell function in those joints over the short term and the long term. And then there's another kind of steroids, the anabolic steroids that are used in the gym. And that gets me into a sort of a subcategory of the steroids, which is the sex hormones. Excess estrogen and excess testosterone. And with the low T clinics popping up all over the country, we see people who are really, really overdosed on testosterone. And it gives a significant increased risk of tendon and ligament injuries and recurrent injuries. So these folks are going in and they're getting their orthopedic or chiropractic treatment and they're back a few weeks later with yet another injury. I would say get them to get their testosterone checked because they're probably over-supplemented. But the bottom line is that all kinds of drugs can promote tendon, muscle, and ligament injuries, specifically because drugs tend to decrease absorption of nutrients and leave you in a depleted state. And so it's not direct toxicity, it's more indirect. For instance, opiates, with some of your chronic pain patients might be on, they deplete B9, vitamin C, iron, and potassium. Blood pressure medications can deplete zinc or vitamin D, calcium, magnesium, phosphorus, CoQ10. Beta blockers for heart rhythm can deplete chromium and melatonin and CoQ10. All these things are necessary for proper musculoskeletal function. The diuretics, the water pills, deplete your potassium, of course, but also your B vitamins, vitamin C, and calcium, magnesium, all the things that are water soluble. The osteoporosis drugs deplete phosphorus, calcium, and magnesium, ironically. Even inhalers that people are on for their asthma can deplete minerals. Anti-inflammatories deplete the B vitamins. Aspirin is a big one that depletes folate, vitamin C, iron, potassium, zinc. Of course, the antibiotics are famous for depleting the B vitamins and vitamin K. So all these depletions of vitamins and minerals really puts a person more at risk for any sort of musculoskeletal injury. And if you have somebody in your practice who's failing to improve or keeps coming back with recurrent injury, really take a look at their medication list.
That's fantastic. I think you got, doctors, I think you got an idea there of what an expert in this field, can just reel this stuff off. And, obviously has been studying these areas like you've been studying the areas of patient care, adjustments, additional procedures that you can do to assist a patient to get better. Now, the first question, if I were sitting on your side, is, okay, what do I do next? How do I start to incorporate this in your practice? And the easiest way I'm going to answer that, and I know you've been following me for a very long time, is you need to read these books. You need to download these books and you need to read these books. These are the easiest books in the world to read. And as you read them, you'll do exactly what I did. Because I started to go, okay, look, I teach nationally about spinal ligament injuries and I teach doctors of what they should look for. These are perfect lead-in books. These are not like volumes, huge textbooks. These are right to the point, simple to read, so that you can start to get more educated on the person that you're dealing with that's right there in your consultation room. And, we will have more. I will bring Dr. Dolan on in a bit. We'll do some question and answers. I'll bring Dr. Dolan on more if you're saying, hey, look, this has been really beneficial for me, and I know Tanya will love this. Email Tanya and just let her know. Give us an idea. Yes, these are the type of programs, because this is the type of information that we want to start to bring you. And in furthering that, I would highly recommend that you go to SmartMed Info. Write it down, smartmedinfo.com. This is Dr. Dolan's blog, and it's a perfect lead-in for any kind of information. If you're looking for information for your websites, information that's more, and I'm sorry it's loading just a little bit slow. It'll load slow because of the GoToMeeting. But this is the type of information that you can repost to your blogs, link to it. When I say repost it, you just link to it. And I mean, the information that's here on top 3 drugs that send people to the emergency room. Skip these drugs if you have an asthma attack. Overprescription of these dangerous drugs is rampant. Less antibiotic, it just on and on and on. Everything that I read in here is just totally the things that you would want patients to understand about. When I read the cholesterol drugs, doctors, I did not realize, and I know many of you do, so I'll give my, what I didn't understand was the fact that the brain, 25% of the brain, 25% of the cholesterol in the body goes to the brain. So if you're lowering cholesterol, I mean, it didn't take a bright guy like me to have an idea that maybe that wasn't the best thing. So I would highly recommend that you go out to SmartMed Info and that you start to look and read and start to direct patients to these types of information sites. Now, the other thing that I want you to know is these beautiful flyers that you see right here. They all have what's called a QR code at the bottom. QR code means that any patient today, and all your patients have QR code readers, can actually take this information, hit it with their QR code reader, and they're right on Amazon, and they can download and purchase the book. Right? So it's a very, very easy way for you to get these out to your patients, because I thought this would be a good idea for us to have available for you. So how do you get them? Real easy. You go to the Spinal Kinetics back office. Those of you that are involved with Spinal Kinetics, you know exactly what that is. Those of you that aren't involved with Spinal Kinetics, I'll give you a way to do that here in just a minute. And we'll get logged in here. Again, this is a little bit slow because we're doing a GoToMeeting. Those of you that are familiar, you know this is the Spinal Kinetics back office. This is where we have some videos about spinal ligament injury testing. But we also have a new area called an affiliate resource, and you'll see Moira Dolan MD resources. And if you click on that, you'll actually see right down below here are the actual flyers. So you can take those out, you can take them to a nice print shop and have them printed up, and then when you have patients in your consultation room that are on these types of drugs and you want to give them information about it, you just send them home with one of these nice flyers that look exactly like this right here. It gives some information about the, the inside of the book. It gives some kind of, I think is exciting information about what they're going to get access to. And the main thing that I looked at for with any kind of referral is whenever you're referring for something, you want that referral to look good on you. And I'm telling you 100%, these will make you shine as directing the patient to the kind of information that's in these books. Okay, doctors, at this point, what I'd like to do is I'd like to open it up to some question and answers if there are any questions. And Dr. Dolan, if you wouldn't mind. Okay, great. So how you do the question and answers, for those of you that aren't familiar with the format, is there's a little box over on your right where you just type in any question that you have, and basically I'll ask those questions of Dr. Dolan. So okay, here's a question that came from a doctor that said, what's the reason that 2% should be on statins?
I'm sorry, you have to read the book for that. It's written in lay language, and again, that's why there's not a yes or no answer. Somebody walking in, should I be on statins? Well, let's take a look at your age, your risk factors. Do you smoke? Are you also diabetic? Are you hypertensive? Do you have kidney insufficiency? Have you already had a heart attack or a stent? Do you have an arrhythmia? Do you have a genetic profile that makes you more at risk for Alzheimer's, in which case we wouldn't want to add to that problem by putting you on statins? So it all has to be taken quite individually. I ran into this with addressing my mom's doctor when he was putting her on some medications, and I said, look, you didn't really even consider the fact that she's got kidney insufficiency, and yet you're giving her this particular medication. In her case, it didn't happen to be a statin drug, and he actually said to me, we're so busy, we don't treat patients as individuals, we treat patients by rote. And sure enough, generally doctors are following national guidelines that are promulgated mostly by people who are in the paid drug companies, and they're just following them blindly without looking at the person as an individual. So, like I said, out of 100 people crossing my path, there's usually 2 of those people where statins are definitely warranted. But I got to tell you, by the time they turn 70, at that point, I consider age, and I go, okay, now at this point, I don't think you should be on that statin anymore. So it's quite individual, and that's all discussed in the book, but it is put in lay language, and a lot of the statistics are gone into regarding how the advertisers manipulate the statistics to give a false impression of benefits for everybody.
It's interesting when you say about the statistics. One of the things that I read was how, I can't remember which one of the statistics it was, but where you test and okay, normally 3 out of 100 people would have this, and now 200 people have this, and now the statistic promoted is 33% improvement.
Yeah, it's the difference between absolute risk reduction and relative risk reduction. It's used in advertising quite a bit. If 100 people over 5 years would have gotten a heart attack if you take 100 people involved in 5 years, and you find that 3 people would have had a heart attack with no medication. If you take that same 100 people, follow them 5 years, but they're on statin drugs, then you're going to prevent 1 heart attack. So instead of 3 people having a heart attack after the 5-year period, you would have 2 people having a heart attack. Now we know that that is a 1 out of 100 reduction, right? But that gets advertised as the difference between 2 and 3 heart attacks, so that's 1/3. So they actually say on TV 33% reduction of heart attack, which is extremely misleading, and it's all described.
Yeah, that's interesting. So, I mean, that was one of the things that was one of the things that was very, very interesting. And I'll tell you what, doctors, like when I say that's one of the things, it's like interesting thing after interesting thing after interesting thing after interesting thing in these books. That's why I love them so much. And you know that I don't promote things unless they're really, really good. So the doctor here asked, can we share some of your blog posts on our Facebook page?
Yeah, absolutely. I mean, I just put out the blog as a public service thing, and if any of you have done any vlogs, you know how much work that is. I try to take the current news that's coming out on a weekly basis and translate into language and really scratch the surface and see what it's really saying, despite what gets reported on Fox or CNN or my favorite worst, public radio. And just say, look, here's what's really, for instance, in this most recent blog on the FDA taking a very unusual move to eliminate the black box warning on the smoking cessation drugs. Everybody's really worried this is going to start a big precedent. You know, I looked at the actual reports that was based on, and I was very surprised that my writing of the blog, in this case, took me many, many, many hours because I couldn't find anybody else anywhere on the internet who had dug into the actual FDA report from the expert panel and dug into the studies, the drug company sponsored studies that led to this removal of the black box warning, and really look at all the frailties in the studies, and that's what's outlined in this blog. So I try to distill down and put in lay language the things that people are hearing about on the news on a daily basis.
Perfect. And doctors, I have the blog up, you know, just so, again, so you understand. You go out to SmartMed Info, and then what you do is you're going to follow Dr. Dolan. If you want updates and updated information of when she releases things, one of the easy ways to do it is just go out to the link that she has there and follow her right on the Facebook, right on her Facebook page. And then as her blog is updated, you get the updates right in on your Facebook notifications. So, but the answer is yes. I mean, that's the beauty of what's being done here, is she's actually providing this information so that it can be shared. And again, you know, that the flyers that we have are so that you can share them right throughout your office. Now I'm going to ask a question. This is off the cuff. This has nothing to do with Dr. Dolan. I want you to type into the question box if you appreciated this program. If this is information and the kind of information that you would like to have from us or more from us at Spinal Kinetics. So if you would, just write in your, and I need your participation here, doctors. Just let me know, yes, is this information that is pertinent and things that you would like to know more about? Was this helpful to you this morning? Just in your question box, just put yes, absolutely. And I want to get a little bit of okay, good. So here's what's good. Doctors, yes, tell me more. This is perfect. So just so you know, I'm getting a flood now, an absolute flood. Great stuff. It'll help. Absolutely great work. Yes, learned a lot. Yes, this information is great. Like the info. Do non-members get flyers the same way? Yes, doctor. Do non-members get the same flyers the same way? Yes, you just go in and you become a member of Spinal Kinetics. It means you're in our system, and you call Tanya at the number that I listed below, and you can get in. You can get this information. Yes, absolutely. Good. So, Dr. Dolan, the doctors here the doctors here are definitely showing their love this morning. Like the information, love the information. Yes, absolutely want more information. Appreciate the resources, to tell you the truth. Perfect. Okay. That's fantastic. Doctors, I don't see any other questions today, and I know that Dr. Dolan's got a fairly tight schedule this morning, and I told her that I would keep it very tight as far as getting her on this program and then getting her off so she can get to her next obligation. So, Dr. Dolan, thank you so much this morning for sharing this information with us, and I would hope in the future maybe that if we invited you to come back, might you come back?
I'd be happy to do that. You know, again, my goal is informing consumers and getting people to really think at least as critically at the doctor's office as they do when they take the car in for a brake job. You know, really raising issues that provoke critical thinking of medical advice And these things can be put in lay language and can be explained. Nobody has time for it in our quick office visits, but these resources, can really empower your consumers.
Dr. Dolan, I'm sure I represent all the doctors online this morning. Thank you very, very much for your time. Doctors, again, with Spinal Kinetics, we will have these programs like this every twice a month. And we're going to start to branch out and bring in experts, authoritative experts like Dr. Dolan in all kinds of areas that affect your ability to get patients well. So, doctors, thank you very much. Happy New Year. I hope you're off to a great start in 2017 and have a good rest of the day.